Hello, ladies and gentlemen. Welcome to my channel. This is Dr. Emmanuel, and today I want us to do a brief revision of the anatomy of the pelvic floor. And just to begin, we can see a sagittal view of a human pelvis. This is the pelvic floor, and we can see some prominent muscles popping up within our view. So here on the lateral side of the pelvic floor, we can see this muscle there. It's fan-shaped, and that's called the obturator internus muscle. Okay, it's obturator internus because it's inside the pelvis, and on the other side of the pelvis, on the outer side, we've seen the obturator externus muscle. And forming a sling in the pelvis is a large muscle that actually is called the levator ani muscle. And from the name levator ani, it sounds like a muscle that elevates the anus or elevates the pelvis or supports the pelvis. So levator ani muscle. And this levator ani muscle has three parts. We have the iliococcygeus muscle, which is a muscle that spans from the ilium all the way around to insert into the coccyx. So that's why it's called the iliococcygeus or the iliococcygeus muscle. We've got the pubococcygeus muscle, and as the name suggests, it originates from the pubic bone and slings around to insert into the coccyx. So pubococcygeus. And we've got the puborectalis, also otherwise called the puboanalis muscle. And as the name indicates, it originates from the pubic bone, slings around, and inserts, blends with the muscles, this external sphincter of the rectum, or the external longitudinal ligament of the rectum. Okay, the external longitudinal ligament of the rectum. So as the name suggests, it slings around the rectum and also blends. Some of its fibers blend with the fibers of the external longitudinal ligament of the rectum. Now, behind, as we can see, still part of the pelvic floor muscle, but not part of the levator ani, is the coccygeus muscle. And this coccygeus muscle is also called the ischio-coccygeus muscle, okay? Because as we can see, it originates from the ischial spine and inserts into the coccyx. So it's ischio-coccygeus. It's also fan-shaped or triangular in shape, ischio-coccygeus or coccygeus muscle. And on the posterior side, we can see this muscle that has different digitations. Okay, you can see it has different digitations, and that muscle is called the piriformis muscle. We'll appreciate these muscles further as we move, through other slides. And here, just of worthy of note is this fibrous, tendinous structure, which is called the tendinous arch of the levator ani muscle. And we'll get to understand that the obturator internus muscle also takes origin from this tendinous arch, as we can see. The obturator internus, okay, originates from the obturator membrane, part of the obturator membrane, part of the pubic bone, originates from this tendinous arch of the levator ani. The iliococcygeus muscle also takes origin from, this tendinous arch of the levator ani, as well as the ilium bone, the ilium. So let's progress. So the pelvic floor, this is extracted, most of the slides here are extracted from the Atlas of Human Anatomy by Frank Netters, including this one, okay? So just a brief summary, the pelvic floor is formed by the pelvic diaphragm, and the pelvic floor is funnel-shaped. It's a muscular portion, serves as a muscular partition from the pubis to the coccyx, okay, from anterior to posterior, and from the lateral wall to lateral wall. So anteriorly spans from the pubis to the coccyx, and of course from one part of the ilium on one side to the ilium on the other side laterally. And the pelvic floor, or this pelvic diaphragm, separates the pelvic cavity, which is above, from the perineal space, which is below. The pelvic floor transmits the urethra, the anal canal, and in females, it also transmits the vagina. Now, what are the functions of the pelvic floor? I think we've mentioned it. It supports the pelvic organs, it supports the abdominal organs. It helps in maintaining bowel and urinary continence. So it supports, remember we have the puborectalis muscle. We also have pubourethralis, smaller portions of this levator ani that sling around, that span around the urethra. So the pubourethralis, the pubovaginales in females, the puborectalis, okay? The pelvic floor muscle or diaphragm also contributes to the sacroiliac joint stability, okay, which is very important in pelvic stability, the stability of the pelvic mortise. So let's look briefly on the proximal and distal attachments of some of these muscles, what they do, and their nerve innervations, or their, the nerves that subserve them or innervate them. So obturator internus muscle, the origin of the proximal attachments is the pelvic aspect of the obturator membrane and the pelvic bone. And why is it being called the pelvic aspect? Because the obturator membrane, I don't know if I have a slide, I've inserted a slide that shows us that. So the obturator membrane lies there, okay, lies deep to the obturator internus muscle, and on the pelvic aspect, which is the internal aspect of the obturator membrane, originates this obturator internus. On the external part of this obturator membrane, that's where the obturator externus muscle will originate from, okay? And there's an obturator canal. So the obturator internus muscle takes origin from these internal or inner aspects, okay? Or we can say the deep surface or the pelvic surface of the obturator membrane. And there it is, exiting the pelvis, okay, running through your greater sciatic foramen. So it exits, there it is, to exit through the greater sciatic foramen and go and attach to the greater tuberosity of the femur, the greater trochanter of your femur, okay? We'll get to see that. So let's go back. So it attaches, it inserts onto the greater trochanter of the femur, and it helps in abducting, externally rotating and abducting the hip. That's what the obturator internus does. Remember, the obturator externus adducts. It helps in flexing and adducting the hip, whereas the obturator internus, because of the way it runs, arises from within the pelvis, exits through the greater sciatic foramen, with the piriformis muscle, and then attaches at the greater trochanter of the femur. So when it contracts, it actually creates that external rotation and abduction effect. The piriformis muscle arises from the anterior surface of the second, third, and fourth sacral segments, and from the sacrotuberous ligaments, and then it inserts into the greater trochanter of the femur. That's the piriformis muscle, taking origin from part of the ilium, okay, and also from the sacral bones, okay, and then also from the sacrotuberous ligaments, okay. So the sacrotuberous ligaments originates from part of the sacrotuberous ligament, and then it passes through the greater sciatic foramen, okay, that's the greater sciatic foramen, exits through the greater sciatic foramen, and then inserts into the greater trochanter of the femur. It also helps in externally rotating and abducting the hip, and they say it helps in stabilizing the hip joint. The levator ani, which is a broad muscle, as we've seen, has three major parts. Arises from the body of the pubis. So we can see the puborectalis, the pubococcygeus arise from the body of the pubis, from the tendinous arch of the obturator fascia, and we saw that the the iliococcygeus, okay, not the ischio, the iliococcygeus, which originates from the tendinous arch of the obturator fascia and the ischio spine, okay? The levator ani has a broad insertion depending on the parts of the levator ani that we're talking about. So the perineal body, the coccyx, of course, the pubococcygeus and the iliococcygeus insert into the coccyx. The levator ani inserts into the perineal body, into the the pubic coccygeus, isn't it? Inserts into the coccyx. The pubis rectalis or pubis vaginalis or pubis urethralis also insert into the walls, the external walls of the prostate, vagina, urethra, the rectum, and the anal canal. That's how they contribute to maintenance of urinary and fecal continence. So the levator ani, broadly speaking, supports the pelvic viscera. It helps in raising the pelvis. When it contracts, it also contributes in increasing intra-abdominal pressure, okay, in moments of Valsalva maneuver, like straining to open your bowels and stuff like that. And coughing, it also helps in increasing intra-abdominal pressure. The coccygeus muscle, also called the ischio-coccygeus, arises from the ischial spine, as we saw, and also from the sacrospinous ligaments, and it inserts into the inferior aspect of the sacrum and the coccyx. The ischio-coccygeus or coccygeus also supports the pelvic viscera. When it contracts, it draws the coccyx forward. It makes sense. This is the coccygeus or the ischio-coccygeus. It originates from the ischial spine and from this sacrospinous ligament, okay? And it inserts into the distal portion, the lower portion of the coccyx. And when it contracts, it pulls the coccyx. So that's the coccyx. It pulls your coccyx. That's the coccyx actually, and this is the sacrum. So it inserts into the coccyx and the lower part of the sacrum. When it contracts, it pulls the lower part of the sacrum and the coccyx forward. So in terms of nerve innervation of these muscles, obturator internus is innervated by the nerve of obturator internus, okay, or the nerve to obturator internus. The piriformis muscle is innervated by the ventral rami of S1 and S2, levator ani ventral rami of S3 and S4, and coccygeus ventral rami of S4 and S5. So let's move. This is a superior view of the pelvis, giving us that topographic appreciation of of what these pelvic floor muscles look like. So we said the levator ani has three parts, and let's identify them. So we've got from the pubis, that's the body of the pubis, the lower part of the body of the pubis. Okay. Right there, we have the superior pubic ramus, and on the lower side, we'll have the inferior pubic ramus, and right there, adjacent to the pubic symphysis, is the body of the right pubic bone there. So from there, we can see that we have some muscle fibers. So the pubo-rectalis will come from the pubis and go all the way around, okay, to the other side of the body of the pubis. And it also blends with the external longitudinal fibers of the rectum, okay, of the rectal canal. And even in females, because females also have the vagina, you have the pubovaginalis, some of the fibers wind around and blend with the muscles, of the vaginal wall, and some of them will also blend with the muscles of the urethra. So you have the pubourethralis, some of the fibers, called the pubovaginalis, but essentially we have the puborectalis or the puboanalis muscle. And lateral to the puborectalis, you can see another band of muscle fibers, which, coming from the pubic bone and the inferior pubic ramus and going backwards all the way to the coccyx, and that's the pubo, excuse me, that's the pubococcygeus muscle. We can see right there the median raphe, okay? So it inserts into the median raphe of the pelvic floor muscle, the median raphe, and then through the anterior sacrococcygeal ligament, it also inserts into the lower part of the sacrum. Right there is the coccyx. And remember our tendinous arch of the levator ani, okay, that gives origin to parts of the obturator internus muscle and the iliococcygeus muscle. So the iliococcygeus muscle arises from part of the ilium bone, from the iliac crest, okay? Arises from the iliac crest, from the tendinous arch of the levator ani, and then inserts into the coccyx, okay? So that's the coccyx, so iliococcygeus. That's our piriformis muscle, okay? Piriformis muscle arising from the S2, S3, S4 part of the sacral bone, okay? Moving out laterally, exiting through the greater sciatic foramen, and then going to insert into the greater trochanter. So when it pulls this way, and it externally rotates and abducts the hip. So sorry, that's the piriformis muscle. That's our coccygeus muscle coming from the ischial spine and going to the coccyx. That's the piriformis that exits through that's the opening, the greater sciatic foramen. Okay, sorry about the mix-up. Moving further, this is an inferior view of the pelvic floor muscle. So you can see we have so many images, and the reason why we have so many images is that repetition reinforces understanding and memory. Okay, when you look at things from different views, look at it over and over and over, it enhances your understanding, it enhances your retention. So that's why we've put in so many slides here, showing exactly the same thing from different views. So still looking at the pelvic floor from the inferior view, we can see the same thing. We can see the puborectalis, okay, from the pubis spanning all around the rectum and blending, interdigitating with the external longitudinal muscle of the rectum. And right there we have the pubococcygeus coming from the inferior pubic ramus, okay, inferior pubic ramus, going all around to insert into the coccyx. And from the tendinous arch of our levator ani, we can see our iliococcygeus muscle, okay, originating, going all the way to insert into both the coccyx, the median raphe of the levator ani, okay. And there we can see the ischio-coccygeus or the coccygeus muscle, and we can see part of the piriformis muscle, cut section piriformis muscle. And this inferior view, we can appreciate, if you look there, interdigitating fibers of perineum, okay? Interdigitating fibers of perineum. So just so many fibers coming from this levator ani, puborectalis or puboanalis, also forming the pubovaginalis and the pubourethralis, okay? So lots of muscle fibers interdigitates to provide support to these hollow visceral structures that transit through the pelvic floor. Okay, yeah. I think we've looked at this. I'm not sure if there's anything more to say. I think the reason I put this is in this image, we can see that the urethra, the rectum, the vagina are not there, but we can see the hiatuses or the openings through which they transit. Okay, so that's the anorectal hiatus, that's the urethral hiatus through which the urethra transits, goes through the pelvic floor, this is the opening through which the rectal canal, the anorectal canal, transits the pelvic floor. So if the vagina was in between, you have the pubovaginalis, the puborectalis, the pubococcygeus. Okay, that's the median raphe of the levator ani. That's the, that's our sacrococcygeal ligaments. Okay, and that's our iliococcygeus. That's our ischio-coccygeus or coccygeus, and that's our piriformis muscle, and that's our obturator internus. So all these muscles form the pelvic diaphragm. Okay, this is a diaphragm, which is different from the respiratory diaphragm, which is the one we typically call the diaphragm for breathing. Okay, but this is also a diaphragm in the body, and this is the pelvic diaphragm, the pelvic floor. I think we've looked at this. I don't think there's anything extra to mention. So the perineal body is right there. We'll see the perineal body when we look at the perineum, okay? When we look at the muscles of the perineum. As we said, the perineum is different from the pelvis. So the pelvis and the perineum are separated by the pelvic floor, the pelvic diaphragm. So the perineum is, plays more role with our external genitalia, the anal canal, whereas the pelvis plays more role with the rectum, okay? And when the rectum transits and becomes, gets closer to the exterior, it becomes the anal canal, at that point, we begin to have the perineal space. We'll look at the perineal space in another video, okay? It's quite interesting. I think this is our last slide. We've come to the end of this revision. Just before we log out, I want us to look for a very good slide that just helps us round off what the structure of the pelvic floor or the pelvic diaphragm looks like. I think this is a very perfect slide to do that. So, in summary, the pelvic floor is composed essentially of these muscles: obturator internus, the levator ani, the coccygeus, and the piriformis. So we can say, broadly speaking, four group of muscles: obturator internus, the levator ani, the coccygeus or ischio-coccygeus, and the piriformis. And then the levator ani itself is composed of three muscles: the puborectalis, otherwise called the puboanalis muscle. We've got the pubococcygeus muscle, and we've got the ilio or iliococcygeus muscle, okay? And sometimes we have pubovaginalis, small fibers that also go around the vagina, and sometimes pubourethralis, little fibers, strands of, skeletal muscle fibers that, spin around or span around the urethra, supporting the urethral wall and helping in the provision of urinary fecal continence, okay? And also playing a role in keeping playing a role in keeping the uterus in an anteverted, anti-flexed position, okay? So they play that role, in supporting the vagina, play that role in supporting the rectum and the urethra. So we've come to the end of this revision, which is a picture-based revision. If you think it's helped you, appreciate what the structure of the pelvic floor is, appreciate the origin and insertion of these muscles, and the function of this pelvic floor in general, I would say kindly smash this like button, subscribe to my channel because more videos will be released in the next couple of days, and share with your friends, family, and every other person you think will benefit from this. Thanks for your audience. Cheers. Have a nice day.